Welcome to Therapist Point. I'm Emily Mendez, a mental health professional. Today, I'll be talking about who needs therapy and who does not. Since the pandemic, rates of anxiety and depression have skyrocketed. These disorders have increased by 25% worldwide, according to a scientific brief released by the World Health Organization. As a result, mental health awareness has risen significantly, which is a good thing. This destigmatizes mental health challenges and encourages those who need help to get it. According to the latest data, there's been an increase of almost 15 million people in therapy since 2002. However, the push for mental health treatment might have went too far. Whenever I do a simple Google search, I notice dozens of ads and blog posts that encourage everyone to seek therapy. Some blogs say that everyone needs therapy. There are numerous celebrities who make going to therapy seem glamorous, and it seems like therapy has become the automatic fix for all of life's problems. As a former therapist, I can say that not everyone needs therapy to be emotionally well. Well, what about feeling lonely from time to time or experiencing anxiety when you go to the dentist? Surely these things are signs that you need therapy, right? No. Everyone has a bad day or goes through a rough patch every now and again. Life is not without its challenges. It's natural to experience sadness, anger, and other negative emotions at times. Feeling angry when someone cuts you off in traffic is normal. Feeling sad when you get fired from a job is also normal. It's not necessary to schedule a therapy appointment if you are experiencing these feelings. These are common feelings that almost everyone has to deal with. If you are able to manage your emotions and deal with daily stressors, then therapy probably isn't necessary. What you can do if you are experiencing sadness, pain, and other tough emotions um, is to work on your emotional health. Not everyone needs therapy, but everyone could benefit from working on their mental health. And there are lots of resources and simple tools available on the internet to help people do just that without the need to see a therapist. You can try one of the many apps that teach meditation or breathing exercises. You can also try listening to mental health podcasts or videos just like this one to gain insight and clarity into your mental health. Support groups can also be very helpful for things like dealing with grief. It can be extremely beneficial to connect with other people who are going through the same thing as you are. You can boost your mood and reduce anxiety by doing simple things like spending time in nature. You can go on a hike, go on a picnic, or garden. Studies have found that being outdoors is linked to lower levels of anxiety and anger. That's because it reduces cortisol, which is the stress hormone. Other ways to boost your mood or improve your life include finding things to do that give you a sense of purpose, like volunteering. So, what if you want to make changes in your life or you want to reach certain goals? Feeling not quite happy with your current life can mean that it's time for a change. Still, this might not necessarily mean that therapy is needed. If you want to make changes in your life, a life coach might be a better choice than a therapist. Coaching helps people who are functioning at a normal level but want to change something in their life. A coach can help you change careers, improve your health, and perform better. So, when does someone need therapy? Well, therapy is not about talking or chatting for an hour. Therapists are not like friends. They have undergone extensive training and education to diagnose and treat mental health conditions like schizophrenia, bipolar disorder, ADHD, PTSD, and major depression. If a person is experiencing signs of a mental illness, then therapy is in order. Mental illness is marked by serious impairments in thinking and behavior that interfere with your daily life. Part of the diagnostic criteria for a mental health disorder is that it causes a significant impairment in functioning. So, for example, you might frequently call into work because you're unable to get out of bed in the morning due to depressive symptoms, or you may experience frequent arguments with your spouse over your increased drinking. Therapy is an evidence-based treatment that addresses serious mental health symptoms such as explosive or uncontrollable anger, intense mood changes, difficulty regulating your emotions, overwhelming sadness or pain, loss that you can't move on from, persistent difficulty sleeping, feeling hopeless or trapped, isolating yourself from loved ones, a reduced interest in things that you used to enjoy, such as sex or hanging out with friends, racing thoughts, inability to concentrate, focus, or remember things, feeling extremely anxious, grandiose beliefs such as feeling as though you are unusually talented, important, or powerful, delusions or having strong beliefs that aren't true or based in reality. An example would be believing that a famous person is in love with you. Bizarre, unusual behavior that other people might notice or point out, engaging in high-risk behavior such as using drugs, significant changes in your eating patterns, experiencing flashbacks or nightmares of a traumatic event, unexplained physical health problems, difficulty maintaining basic hygiene, self-harm, thoughts of death, or suicide. If you are experiencing suicidal thoughts, it is an emergency. In this case, it's best to contact the National Suicide Prevention Lifeline at 988. There you can talk to a trained counselor. You can also call 911 in the United States or go to the nearest emergency room if you are in immediate danger. You don't have to be in an emergency or have severe symptoms to seek mental health support from a therapist. If the symptoms are interfering with your daily life, it's time to seek help. Also, if your loved ones or partner are concerned about your mental health, then it's a good idea to consider therapy. Sometimes loved ones notice that something is off about our behavior that we might not notice. If you do need therapy, the first step is to visit your primary care doctor. You'll want to rule out any medical issues that could be causing the symptoms. Some medical problems, like thyroid disorders and Lyme disease, can cause psychiatric symptoms. After your doctor has ruled out medical problems, the next step is to find a therapist. You can find a therapist online, such as through Therapist Point. On Therapist Point, you can conduct an online search for top therapists in your area. You can also learn more about your specific mental health issue and watch videos like this one on mental health topics. Not every therapist will be a good fit for you. In order for therapy to work, there must be rapport. So if you don't have a good connection with your therapist, it doesn't mean that you won't benefit from therapy. It may just be that you need to find a new therapist. On Therapist Point, it is pretty easy to find a new therapist as well. So, what issues do you work on in therapy? Typically, sessions focus on developing skills that improve mental health. That could be learning to identify things that trigger a relapse of mental health symptoms. It could be developing greater insight into your behaviors and working on coping skills. The exact interventions depend on the person and what issue they are struggling with specifically. So, does a person need to be in therapy forever? The answer is no. Staying in therapy for too long is a waste of resources and time. When you have accomplished the goals that you've set or you've reached a plateau in therapy, it's time for therapy to end. So, wrapping up, while the increasing focus on mental health is a great thing, not everyone needs therapy. Therapy is a science backed treatment that's intended to treat mental health symptoms. It should not be broadly recommended to everyone. Minor issues like brief periods of sadness or anxiety, which everyone experiences, can be dealt with using self help techniques such as practicing meditation and spending time outdoors. However, serious mental health symptoms that interfere with work, school, or relationships are a very good reason to go to therapy.